Good morning, everyone. This is LadyDragon speaking. Now, we're going to watch a keynote. It had a very long list of people, but it has to do about health. The Heart Association, the Cancer Association, the Alzheimer Association, and another thing called Small Train. No idea what it is, but didn't have enough space in the title. So let's see what they are saying. It's Monday, January 27. It's 8:23 a.m. We're finishing the keynotes today, so let's dive in right now. We'll talk after.
Good morning, everyone. I'm Gretchen Littlefield, and it's an honor to moderate today's Great Mind session on how mission-driven innovation is solving humanity's biggest problems. Thank you for being here. As the CEO of More, I'm privileged to lead a CXM company that helps some of the most important purpose-driven organizations accelerate their growth, advance their incredible missions, and deepen people's connections with the causes they care about most. Today, we're discussing how technology, data, and AI are transforming the way we tackle the world's largest challenges. Leaders from some of the most impactful brands will share how they're using innovative solutions to address critical issues like heart disease, cancer, clefts, and Alzheimer's. It's crucial that we have this conversation right now. At CES this week, incredible announcements about innovations with AI have been made. But how will those advancements help society at large and those in need? So let's get going. I'm excited to introduce some of the greatest minds in the purpose-driven sector. Joining me today is Nancy Brown. Nancy is CEO of the American Heart Association, an organization dedicated to driving breakthroughs and proven solutions in science, policy, and care to advance heart and brain health. Nancy is a global authority committed to science and technology innovation. Thanks to the association's work spanning 100 years, we have access to artificial heart valves, implantable pacemakers, cholesterol-lowering medications, techniques for CPR, and many other medical triumphs. Next, let me introduce Dr. Wayne Frederick. Dr. Frederick is interim CEO of both the American Cancer Society and the American Cancer Society Cancer Action Network, where he guides the organization towards its vision to end cancer as we know it, for everyone. Dr. Frederick is also President Emeritus of Howard University and a practicing cancer surgeon at Howard University Hospital. American Cancer Society aims to improve the lives of cancer patients and their families by funding cancer research to generate cancer-reducing breakthroughs, increasing access to these breakthroughs through advocacy, and directing patient support in more than 5,000 communities across the country. American Cancer Society touches more than 55 million lives every year. Also joining us today is Dr. Joanne Pike. Dr. Pike is president and CEO of the Alzheimer's Association, the global leader in Alzheimer's dementia care, support, and research. The organization provides education and support to people and families facing dementia through their 24/7 free helpline, website, and community-based resources. It's advancing research toward treatment, prevention, and one-day cures through an investment totaling more than $430 million across 1,000 projects and 56 countries. All of this work supports the association's vision of a world without Alzheimer's and all other dementia. Finally, we have Susanna Schaefer. Susanna is president and CEO of Smile Train, the world's largest cleft-focused organization that supports surgery and other forms of care for children across the globe. In just 25 years, Smile Train has supported free cleft care for more than 2 million children over 95 countries. They are scaling high-quality cleft care and transforming global health as a whole, empowering medical professionals worldwide through leading-edge training and innovative, resilient technology. So let's get going and hear how they are all using technology and data to change the world. First question, and this is a question for everyone, is how is technology transforming your organization? Nancy?
Sure, thank you, and thank you so much for the honor to be here today. I think it's especially fitting that this panel is happening on the day that President Jimmy Carter is being remembered with his incredible service, if any of you saw it this morning, because boy, talk about a person who lived with purpose. At the American Heart Association, just a bit about who we are, you described us very well. Our mission is to be a relentless force for a world of longer, healthier lives, and we have a presence in over 200 countries where we extend the work of the AHA, and I would say that technology touches every part of our organization, and has for a long time. I think many of the new technologies offer great ways for us to be able to help patients and help doctors and scientists be able to do their work more quickly and more effectively. And let me give you a couple examples. One example is we are the authors of the clinical practice guidelines for everything heart disease. You go to the doctor and they say you need to do these things to manage your heart health. We write those guidelines. We write them for stroke and we write them for CPR. When you think about what it takes to call through all of the clinical trial data to determine what are the most effective recommendations, we don't see a day where the human touch won't be part of that. But there's ways that technology can really help automate what now is a very slow process. And one of the biggest criticisms, perhaps, in guideline development is the amount of time it takes for something that is a proven, FDA-approved, device, drug, et cetera, to make it into a guideline. So if we want patients to live longer, healthier lives, we've got to find a way to speed that up. I would say through the science and research of the AHA, we have right now active about 186 research projects focused on extending and expanding the way we think about cardiovascular and stroke care through AI. And we're about to create 3 centers of excellence in artificial intelligence and cardiovascular disease with a board commitment of $12 million to do that. And our goal here is to think about how we both test the positives and the concerns around some of the AI approaches for earlier diagnosis of patients with cardiovascular disease. It's a real victory that death rates from heart disease have been cut in half in the past 100 years. But what we know today is that when a person is finally diagnosed with having extensive cardiovascular disease or having high risk factors for having a stroke, chances are, it wouldn't be possible to modify things just through lifestyle interventions. And so if we can identify those at greatest risk earlier, that will be a huge win for patients and their families. One of the research projects I'll mention that we're funding looks at persons with migraines. Joanne, you'd be interested in knowing about this, and early cognitive impairment, and identifying people through the technology that are most at risk to have a stroke in the next 6 months. And so imagine, the difference in people's lives that this technology can make. So we're very excited about the use of AI and new technologies in helping to reduce risk from heart disease and stroke. I will say, however, that we're also concerned about the ethical use of technology. And so we have a board committee that is putting together an ethical framework for the use of new technologies in things like research. We have 16 scientific journals in our journals, in guideline development. And we also, of course, want to be sure that this technology doesn't create further disparities in access to care or disparities in who is being included in the studies that use these new technologies. So lots of exciting things happening and lots of promise for patients and their families.
It's incredible, truly. Dr. Frederick?
Yeah, Gretchen, again, thanks for having all of us here. And as Nancy said, this is certainly a very important day when you look at the longest living president who lived for 100 years, succumbing to cancer, but also living through the last couple of years of his life in supportive care. Technology and AI, I think, is extremely important around all of these issues. The American Cancer Society uses patient advocacy, patient support, research, and direct patient care in terms of how we want to end cancer for everyone. And as a practicing surgical oncologist, I think the technology use and employment of technology is critical. I'll give you an example. I operate on patients with pancreatic cancer. And oftentimes we're trying to get a 1 centimeter margin. It's fairly standard in treating cancers, but the reality is we're all very different sizes. We're all very different people with very different genetic makeup. And so I often use this analogy for my students. A 4'11" patient who comes in who may have a 1 centimeter lesion in her liver has to have a different operation than someone who is 6'8" with the same 1 centimeter lesion. We're still getting a 1 centimeter margin in both patients. And I would argue that as we collect more data and we're able to use large language models, algorithms, and apply AI to all of that data, we're going to come up with precision medicine requirements from someone like me to plan that operation, right? And that I would suggest that probably in that shorter patient, that smaller build patient, that 1 centimeter margin may not be as necessary as the patient who's 6'8". That patient might actually need a 2 centimeter margin, as an example. Currently today, we do not have an application for data that will help us get there. And I think AI is one of the things that will help us get there. And that's an example where the American Cancer Society can partner with others in terms of collecting data. Another area is on the issue of navigation and access. We do reach 55 million Americans, but they are in all different parts of this country. Some areas are extremely rural, in which getting access to a particular provider is in and of itself the determinant for someone's outcome. Some patients are traveling over 100 miles to get care. And just think about that, if you're getting chemotherapy and having to go back and forth over 100 miles, or if you do, you may have some patient support from the American Cancer Society and be able to stay at one of our 31 or 32 lodges, our Hope Lodges. That's not enough Hope Lodges, as you can imagine, for everyone, but even if you were able to stay there, getting that information to stay there would be important. My first day on the job, I spent at the Baltimore Hope Lodge and met a woman from the Virgin Islands who was having an operation at one of the medical centers in Baltimore. And she was there with a family member from Ohio. And I was asking them, how did they come upon this? And it was almost a little bit of a stumble. I think technology and AI, our website, is improving, but being able to get that information to physicians early on so that those physicians can then provide that information to patients ahead of time in terms of where they go. On the advocacy side, it's extremely important. And when we look at what our legislators are doing across the country, it's extremely critical for especially, I would say, around the issue of screening and prevention. We now have data that suggests that younger people are getting cancer earlier. How do we get those patients into the system since our screening guidelines do not bring them into our system? There's no reason for a 28-year-old to be concerned about colorectal cancer and to go get a colonoscopy. But there must be some genetic trigger, some symptomatology that brings us to that issue. And so one of the things that we are looking at as well is how can we use AI and technology to get that information to patients, to advocate within our healthcare system to make sure that those patients, when they do show up and are suggested to get a colonoscopy, the red tape of the bureaucracy that may meet them because of their age and the screening guidelines and is not so rigid that it doesn't allow them to get there. And so we have one of our representatives from the policy team is going to be part of a workshop on clinical trials and using AI to determine where patients should go. And I would say, to close on this issue of AI and technology, the ultimate thing that I think all of us here are trying to do is to amplify other people's humanity. That's what our organizations are trying to do. Yes, we are trying to extend lives, and we're trying to make sure that people don't lose their lives to diseases that we think can be treated. But ultimately, we want that to be done in a compassionate fashion. And the other thing that we must think about is what is the quality of life while people go through those treatments. And that looks different for everyone, and everybody has a different level of support system around them. And we hope that we are able to use technology and AI to bring that support in a more personalized manner. What one family may need is very different. The one thing that always binds our patients that I see in my practice every day is courage. The courage of the family and the courage of the support system around them. And I think that if we can continue to enhance that through technology, to put patients in the right place during the holidays, to make sure our Hope Lodges can be expanded and accommodate them in a different way. Can they get their chemo at the Hope Lodge rather than having to go to an infusion center? Can they get their blood tests at the Hope Lodge rather than having to travel 5-6 miles to a center and come back every day? All of those things bring on an added psychological burden that we hope to be able to alleviate, as well as we use technology and apps to get patients the care that they need.
There's certainly never been a bigger opportunity than there is right now. It's not so much a technology opportunity, in my mind, the biggest limitation we have right now is just organizing ourselves to actually take advantage of all the technology that is available. Dr. Pike, how are you harnessing that technology now?
Thank you, and I want to add my thanks to you, Gretchen, and to Moore for the invitation to be here, and also to my co-panelists, because we're learning as we go, and I thought of this as an opportunity to learn from some great mission-oriented organizations who have been leaders in their space and advocates on behalf of patients. In Alzheimer's and dementia right now, we are in an incredibly dynamic time. We are at a place where we are seeing diagnostics and treatment come out of the research pipeline for the first time in our history as a disease. We have 3 FDA-approved treatments that have been approved in the last 24 months, which is a first that treat the underlying biology of the disease, not just the symptoms. At the same time, we're seeing a rapid understanding that we need to move from a clinical presentation diagnosis alone for Alzheimer's and dementia to a biological-based definition along with clinical presentation. Now, you combine both of those factors, that we are seeing advances within our understanding of the disease, our treatment of the disease, the diagnostics around the disease, at the same time that technology, AI, and machine learning are having a moment, shall we say. So this opportunity, this dynamic piece of the environment that we're working in right now gives us an incredible learning environment to be able to think about what are the protections, the safety, the learning that we can rapidly apply within the clinical environment, and how do we do that in a way that facilitates the best use of these medicines that are coming to market. We've been thinking about, as Nancy mentioned, guidelines, and what are the implications and the practice and the use of guideline-based medical care within Alzheimer's and dementia. For organizations like the American Cancer Society, the American Heart Association, who have been deeply involved in medical guidelines, this is an opportunity for us to learn, apply, build evidence-based, scientific-driven medicine in a way that uses this technology and AI in a way at the same time. So we're in the process of thinking about how do we do all of this together. One of the first things that we did when we knew that we were going to have a treatment come to market was immediately start to build a diagnostic and a treatment registry. The first and only existing treatment registry right now that really looks at the whole span of treatment, diagnostics, care, and what a patient goes through within the medical system. That really leads us to the ability to know from the back-end data, how do we apply the safety principles that we know are important to protect the brain? How can we use that information to learn rapidly in an environment where we are seeing the use of these treatments new, novel, teaching physicians how to use them? So there is a significant amount of opportunity right now for us to think about how do we apply technology, especially given the fact that we are in this place where in a new understanding of a disease, we have to rapidly move, we have to rapidly apply, and we have to change physician and health system behavior in a way that meets patient need differently than what we have seen historically.
Susanna, Smile Train was founded by a technology entrepreneur, a really incredible man, and I know that you guys have always been on the cutting edge of technology. How is it transforming your organization now?
Sure. Thank you, Gretchen, and thank you for inviting me to be on this panel. It's really an amazing experience and an opportunity for us to talk about Smile Train and our work. And you just touched on our founder. Charles B. Wong was a technology entrepreneur. He founded Smile Train in 1999 with no personal connection to cleft, lip or palate. He just understood the backlog of patients at that time that were around the world, millions of patients with untreated cleft. You can't imagine what it would be like for anyone to be living without access to care, with a facial difference that would cause isolation, children can't go to school, bullying, I mean, the list goes on. So he said, what can we do? How can we be different and find a different way to treat cleft? And being a technology entrepreneur and the founder of Computer Associates, he wanted to use technology and really find a more simple way to treat cleft, which was not to do a mission-based model, which was very popular in the 1990s, and still today, mission-based treatment is still happening. What is mission-based treatment? That is when medical professionals are flying to low-resource settings, treating patients and leaving. And our founder felt, who is taking care of that child who didn't make it into that 1 week of treatment when those medical professionals were there? So he wanted to find a different way to do that. And so that was how we applied a teach a person to fish model, which is to train local surgeons and local medical professionals to treat patients with cleft. So being that he was a technology entrepreneur, he passed away in 2018, technology is in our DNA. So he said, let's always put technology at the forefront. Let's use it as a tool in a way to be able to train local surgeons. The issue with cleft treatment, it's such a specialized care of surgery that needs to happen to treat cleft. So we need more surgeons in low resource settings, surgeons that can obviously treat cleft, and the medical professionals needed for the ongoing care. So what Smile Train provides through our partners, through training over 2,200 medical partners around the world, is not just the surgical care, but we train nurses. We partner with AHA to run safe surgery programs. We train speech pathologists, we train orthodontists, and we use technology as a tool. We have launched a virtual surgery simulator back in the 1990s, which now today is a platform of virtual reality. It gives medical professionals, surgeons, access to training materials on a platform where they can really use the technology to improve their skills and learn more about surgery. We also have acquired Simulaire Medical. We acquired Simulaire Medical in 2020, and this gives surgeons a 3D and sorry, I'm losing my words here, but a 3D simulator that they can practice surgery on and are able to improve their skill sets. And they can do this repeatedly so that when they're ready to operate on patients, they have the skills needed for high quality outcomes. Yeah.
No, it's an incredible example of how technology can be used for good and to be able to help people worldwide. It's incredible. I think right now we're in a very unique time, as Dr. Frederick was talking about and Dr. Pike, with artificial intelligence and the possibility that large language models present to us right now, where we're able to process huge amounts of data to be able to find cures for diseases in ways that we've never been able to consider in the past. And I know, Nancy, that's something that you're interested in as well. How are you guys using artificial intelligence?
Yeah, gosh, we're doing a number of things on this, diagnosing people earlier. You know, you can look at people who might be at risk for something like having a stroke, as I mentioned before, aortic stenosis, people that have a cardiomyopathy or an enlarged heart or early heart failure. You know, chances are their imaging tests long before have shown their risk. And so we're using a lot of AI technologies to be able to do rapid review of imaging tests, as an example, through our quality improvement program, Get With the Guidelines, which is in 3,000 US hospitals and thousands outside of the US, to be able to say, here is a cohort of people that are going to be missed in the system.
Yeah.
You know, persons who, you know, clearly if you put all their, you know, their blood work, their imaging tests all together, they're the perfect profile of someone who is going to be diagnosed down the road with a particular cardiovascular condition. We're doing a number of those programs now. Speaking as Dr. Fredericks did about those in areas with less access, we're very proud that we've focused a lot on rural, you know, healthcare systems in rural America, patients in rural America, and we've created a federated learning platform that allows HIPAA-compliant data to stay within a healthcare system, but also to be shared among and across a number of systems, and we're rolling that out first in our rural healthcare Get With the Guideline hospitals, again, on this exact idea of identifying persons who need to have earlier diagnosis and treatment for hypertrophic cardiomyopathy, a form of congestive heart failure. I would also, you know, say perhaps one of our great examples is around CPR. Now, I think CPR, for those of you not in the heart field, probably became very aware of the importance of CPR and early access to defibrillation when Damar Hamlin had his cardiac arrest on Monday Night Football 2 years ago, on January 2nd, 2 years ago. You know, for us, this has been our mission since the 1960s, to create the guidelines to train healthcare providers and lay persons on how to use CPR. An important fact to know that out of hospital, if someone has a cardiac arrest outside of a hospital setting, fewer than 10% of those persons survive, because there are not people around them that know how to use the system or know how to use a defibrillator. And in hospital, only 25% of patients who have a cardiac arrest in a hospital survive. We train 95% of all of the healthcare workers in America on ACLS. I'm sure you've had your ACLS training, absolutely. And so we've really used AI and new technologies to revolutionize the way healthcare providers receive their ACLS training. We created what's called Resuscitation Quality Improvement, which is a subsidiary business of the AHA in partnership with Laerdal Medical, where we have simulation stations that use artificial intelligence to help what we call high frequency, low dose CPR training. Because if you run a hospital system, every 2 years, every healthcare provider in your system has to be recertified in their ACLS. Imagine if you didn't have to pull people off the floor for a week, you know, to take their ACLS course, and instead every 90 days their skills could be tested on this simulation station, and we can use AI in the background to give feedback about where the best quality CPR is happening and where is not. Like, I always think to myself, if I were a patient in a hospital, I would love to know that in the last 90 days my healthcare provider has had their CPR training recertified instead of 450 days ago. And so we are seeing new outcomes, and all of that data from all of these healthcare systems around the world creates a huge repository where AI can be used to help us learn from the places that are doing it best. And then on the consumer side, we're creating technologies through our Center for Health Technology and Innovation, where we have 50 companies, part of our health tech collaboratory, that are looking at how we can revolutionize using AI the availability of people who know CPR or where AEDs are placed in communities, because that's the reason that people don't survive out of hospital cardiac arrest. As we say, the world saw on center stage every step of the chain of survival happening perfectly when Damar had his cardiac arrest. Sadly, that's not what happens for most people. And so we are committed to use new technologies and use AI to change that. That's probably the best example I can give you.
And I'm just, the parallels between what you and Susanna were talking about being able to use technology and AI for training to give people access in places to information, but also skill sets that they wouldn't otherwise have, is just incredible. And I think it's all about what we hope happens from technology. So Dr. Frederick, last night you were talking about AI and the incredible opportunities that it presents, but also you mentioned how skill sets are changing for physicians and for people in your field. I would love if you could talk about that for a minute.
Yeah, no, absolutely. You know, when I trained, which is, I feel now quite some time ago, to take out somebody's gallbladder, it was routine for us to open up somebody's abdomen and do that. Today, that is the exception to the rule, right? We use laparoscopic surgery. And you look at most cancer surgery today, something like a radical prostatectomy, where we're really concerned about the nerves in the pelvis. Most of those operations are being done by robotic surgery today.
Yeah.
And the rapidity with which that technology is changing what that operation looks like and what the ultimate outcome from that operation is like is incredible. And unfortunately, one of my very dear friends had one of those operations recently. He had his operation on a Friday, sometime around noon. I was able to see him around 3, 4 p.m. By the next day, he was in a car to travel some 400 miles back home, got home and was perfectly fine, had his catheter out by the next week. Back in my day, that was a 2-week hospitalization, just as an example. Wow. And so you look at something like that in terms of where we have come, even in terms of when we think about cancer, sometimes we don't think about those other burdens that come along with the treatment. And that has been a significant part of the cancer care. The other thing I would say is, you know, Cancer Facts and Figures is a document that we put out every year. It's embargoed until next week, January 16th. But I'm here to tell you the preview of that as well has a lot of implications for what we will do with data. Younger people are getting cancer, we know that. Recently in the news, there's been conversations about how much alcohol one should drink and its implication with cancer. We've had conversations about cessation of smoking and the fact that women probably started smoking later than men, and whether there's going to be a tail in terms of women getting cancer for longer. All of those pieces of data are data that we're trying to put in and to use that rigor around that data to help the society decide who should go get certain screenings and where. And the last thing I would say is that precision medicine is so critical. Our family histories are not always well known to us, but through genetic testing, there's a lot of familiarity that we can assume that large language models, and as you apply AI, can then suggest to us that, listen, while you may not know of the people in your family that have had disease X, based on all these other characteristics, we suggest you get a colonoscopy at 30 versus the current recommendations today. And I think those are some of the critical things that are happening around our use and application of data that I think will really accelerate what you see coming out of the American Cancer Society and in general how we view cancer as a disease going forward.
It's a different skill set that's needed today than it's been in the past.
Totally different skill set. Our medical curriculum has to change. I'm a big advocate. We were in the acquisition of data model where I had to learn every nerve, every muscle, every vessel. And I would say the next group of medical providers has to know how to apply data and not necessarily acquire and hold all of it. And so we have to have AI in our medical curriculum as part of that.
And I think that's true for almost every field. I mean, I know in the marketing field, I'm not really a marketer, I'm a data scientist person, but it turns out that marketing is shifting in a way that data is the driver behind all of the innovation. And so, Dr. Pike, what are you seeing for Alzheimer's? What's the role of artificial intelligence for you all?
we're really thinking about it at a basic level from two sides, how we serve and how we work. And from the standpoint of how we serve, we're really considering how can we think about the place we are, as I mentioned, in the landscape of Alzheimer's and dementia, what needs to be done within that, and how can we utilize AI to speed the process. One of the most important factors within treating these new treatments that we have for Alzheimer's is early diagnosis. We have seen in the data that the earlier someone is diagnosed, the earlier they start a monoclonal antibody, the better their outcomes. And also, there are some safety implications within that as well. So how can we utilize and harness the power of data and AI within that from the standpoint of medical records, the clinical integration within that? How can we find individuals who may be at risk for cognitive impairment and get them in the diagnostic pipeline faster? There was a Lancet Commission report that came out earlier this year that highlighted 14 risk factors, and that if we were able to control those 14 risk factors, it could prevent up to 45% of dementia cases worldwide. Now, you can imagine some of those risk factors are things that we as individuals can control and some things that we cannot control. If we could find everybody who did not control their blood pressure, as an example, we could change the landscape of dementia diagnosis long term. So being able to find those individuals, being able to treat them faster and successfully is an incredibly important piece within the data and AI landscape. I think the other piece that I might mention from the standpoint of how we work, I think everybody as an employer thinks about how they can use AI to harness the power of personal interaction while removing the burden of all of the minutia behind the scenes. We need to do that as well. We need to empower our staff caregivers to be present, to provide better service, to think about how we can build an AI care model for individuals to utilize and remove the burden of the back-end documentation. You mentioned that 24-hour-a-day, 7-day-a-week helpline that we have. We have the power to potentially change how those individuals who are social workers, counselors, how they provide service through the power of AI and machine learning.
Susanna?
Yeah.
How is it impacting you?
Well, when I spoke earlier, I mentioned technology as a tool. So we always look at it that way at Smile Train. We need to continue to innovate on it. I'm listening to the other panelists, you're trying to find cures, right? You're trying to help patients diagnose heart disease early. There is no known cause for cleft. The only way to treat cleft is through surgery. So technology for us is used to find innovative ways to train local medical professionals, to have the data capture of the patients or beneficiaries that we're treating. We have a database called Smile Train Express, which has captured every patient treated by Smile Train in the last 25 years. Their ongoing treatments. When you think about where Smile Train is working, we are working in over 75 countries around the world that there is no access to care. They don't have what we have here in the United States, where there's an insurance program that's covering the cost of surgery. These families have no hope. So it's how do we use technology to train more surgeons? How do we use the data that is in our database in Smile Train Express to inform just how we expand and scale our work to meet the needs of cleft families around the world.
Okay. We only have a few minutes left, so just in a few words, are you optimistic about the future of technology and AI in your field?
Want me to start?
Yeah.
I'd be happy to. I'm very optimistic, very bullish. I think there are things we need to be concerned about. Data in is data out. So, we have to make sure that representation is really critical among persons of, you know, all categories, race, ethnicity, you know, men, women. We already see huge disparities in care of women with heart disease versus men. Like, let's not add on to this problem. So that's a caution. You know, making sure that we are always thinking, and that companies that we work with are always thinking patient first, you know, because how can we enable better, more sophisticated, quicker, faster, more complete care? At the end of the day, and you know, I think we would all agree with this, the most important thing a patient wants is for the doctor or healthcare provider to be able to hold their hand and guide them through their health journey. And if new technology can allow that to happen, you know, we're all for it. I think we have to be serious about these ethical frameworks of how technology should and shouldn't be used. We're very serious about that at the HA, but we're very high on the future for persons in this country in healthcare and in science because of new technology and AI.
Yeah, I'm over the moon about it. I am a father of a 20-year-old professional soccer player and an 18-year-old freshman in college, and I can assure you that I am very optimistic about our youth and our future, and a lot of it has to do with the fact that they have tools that they're going to use well. And I think one of the things we don't accept as a society, but it's true based on data, is that this generation is the most altruistic generation.
Absolutely.
Probably because they have more information about people they will never meet, and therefore have developed an empathy in a way that we all could benefit from. What I think is important, however, as we look at that application of technology as we go forward and how we use it, where it's applied, who has access to it, I think all of these things are extremely critical about the use of technology, how we apply it, where we use it. I'm not fearful of it as well, because I think that's the other thing that we've been doing that is going to cause us to delay the adoption. Now, our adoption is what I'm worried about. You had about 4 decades before 1 million people drove a car. So you had time to have enough accidents, to build traffic lights, to do all those other things. The difference today is that technology is changing so rapidly that as a society, I don't think we're moving quickly enough to put up the safeguards in place. And I think we need to spend some more time being thoughtful about that aspect of our technology versus then. It took, I think, also another 4 decades or 5 decades for 1 million people to use a telephone. And look at where the telephone is today. I remember those Dick Tracy flip ads when I was a kid looking at that comic. So we have to, as a society, I think, invest as much on the policy side to be able to keep up with how rapidly the technology is changing so that we can adopt it.
I couldn't agree more with what's already been said. I think that there is significant opportunity, but also a significant need to make sure that we are protecting the vulnerable. Within the Alzheimer's and dementia landscape, we have a very vulnerable population. And I think within that piece, there is benefit within AI, and there is potential harms. In the landscape where we are talking about an explosion of technology to support our population, we need to ensure that that technology, those products are built in a way that inform evidence, are built on evidence, and not just good ideas. We need to make sure that we're harnessing that in a way that is going to benefit those who could seek better treatments, while also protecting those who need to have safety concerns in place.
I'll tie it up.
Yeah.
So for us, yes, that's all I can say. There's so much opportunity ahead with technology. You know, a big part of our work is awareness, raising awareness for cleft lip and palate treatment, that there is a smile train that people with untreated cleft can go to get 100% free support for cleft treatment. So there's so much connection in there with technology and reaching more people. Not everyone has access to resources for information on cleft treatment, but everyone around the world has a smartphone. So that is how we see that connection piece.
That's just awesome.
You can find a Smile Train treatment center through your smartphone.
Thank you all for sharing how you're using technology to change the world for better. To me, I think the biggest winners for AI and technology breakthroughs are going to be organizations like yours and all of the people that you're serving. And I have no doubt that today's going to inspire a lot of people. And I want to thank also the Consumer Technology Association and CES for creating a place where innovators can come together and develop technologies for good. And this is just fantastic. And I think you're all a perfect example of all of the great opportunities coming from advancements in AI and technology. Thank you.
Thank you.
Well, that's what I told you, that the Samsung new phone, you need to watch the press conference I did, the last one, the Galaxy Unleashed. That goes with what she said, with the telephone. Okay? Now we're gonna go do, I have 3 left, 3 keynote left. We're gonna do the one with NASA is there. They're gonna talk about returning to Mars. I want to see that. No, returning the moon and Mars. I don't know, I didn't see it, but I'll come back in 5 to watch it with you. C'était, comme je l'ai dit, la conférence de presse de Samsung, c'est très important. Parce que la dernière que j'ai faite, la Galaxy Unleashed, que j'ai faite la semaine dernière, que avec ce téléphone-là, ils ont des software à l'intérieur, ce que tu peux connecter avec des docteurs. Très important que vous regardez ça. Très important. Là, je reviens dans 5 minutes. Ça va être NASA return to the moon and goes to Mars, something of the sort. Fait que je reviens dans 5 minutes. On va faire un autre keynote concernant NASA. Ça devrait être très intéressant.